Hi, Namaste from Bengaluru once again. I was live on bigfm India Instagram page. For some reason, I had to disconnect and I'm back now. Hello, everyone. So, the main reason behind this live video is we are going to converse with Dr. Chandrashekar Ratkal from Bengaluru. He is one of the most senior urologists, and he'll be sharing some great information that everyone must know about urology, and he'll be addressing the issues that we are facing day to day life. So I'm just waiting for the doctor to join the Insta live once again. So he was on call with somebody. Okay, great. So doctor is with
Okay. Okay.
Hi, sir.
Yeah. Good
Hi,
evening.
doctor. How are you?
Oh, fine. How are you?
Namaskara. I am good.
Namaskar.
So we both are speaking from Bengaluru. Doctor is senior consultant urologist at Rescue Urology Hospital, Bengaluru. As I
Yes.
said, as I mentioned in the beginning, he is one of the most senior and experienced urologists of Karnataka. So, hi, doctor. Welcome to Insta Live that is being conducted by Big FM India.
Thank you.
So, doctor,
Thank you.
please
Can
tell
you hear
us
me?
how. Yes, doctor.
Can you hear me?
Yes, doctor. Absolutely, very clear.
Can you see me also? Both.
Yes, we can
Yeah,
see you
fine.
clearly.
We'll continue.
Can you just put your camera a little down so that we can see you more? I mean, you have to tilt it. Yeah, this is better. This is better.
This is okay?
This is perfect because the comments will.
Yeah, I kept it on laptop. I took it out.
Okay, now we can see you, doctor. Great.
Fine.
So, doctor, tell us before getting into the conversation about urology, I would like to know how is your COVID time, lockdown time being spent, because you guys, doctors, are the corona warriors, the major corona warriors of India, of the nation. So I'm sure we all spent a good time in the time of lockdown, and doctors had more responsibilities in the time of lockdown. So how is that lockdown time going on, doctor?
Mine is a special urology hospital.
Mm-hmm.
I retired from government service. I was working 30 years in Victoria Hospital only.
Great. Okay.
Bangalore Medical College. Bangalore, I was professor, HOD, and also director. I retired from there.
Okay.
So my son is also urologist.
Mm-hmm.
Now I am 66. Okay.
Okay.
My son is my son is also urologist.
Oh, that's
Initially,
great.
I worked for some time, but later on he said, no, you are 66, but I am quite healthy. No comorbidities with me. Okay.
With
So,
God's grace. Yeah.
but now he has stopped immediately. Last 1 month, he is only managing OPD. I am totally
Okay.
free, doing some
Okay.
yoga, reading something that is
Mm-hmm.
spending time
Okay.
leisurely, enjoying the
Okay.
holidays.
Wonderful, wonderful, doctor. So
No,
tell
I'm not
us
hearing you.
Sorry, can
Can't
you hear
hear.
me, doctor? Can you hear me now, doctor? Doctor, can you hear me now?
No, I can't hear you. Okay.
Audio got muted?
ಏನಾಯ್ತು ಕಾಲ್ ಬಂದು this call is coming. That's why it's
Okay, you just have to
I
disconnect
can't
the
hear
call.
you. Can't hear you. Okay. ಹಂಗ ಇದಾಗುತ್ತಾ ಅಂತ ಡಿಸ್ಕನೆಕ್ಟ್ ಆಗುತ್ತೆ ಅಂತ because there is a call coming.
Okay, you just have
Hello.
to disconnect the call, doctor.
Pardon?
Please reject the call.
ಆ ಕಾಲ್ ಇದ್ದಾಗ ಇದಾಗುತ್ತೆ ಇಲ್ಲ ಇದು ವಾಲ್ಯೂಮ್ ಇಸ್ ಗುಡ್ ಎವ್ರಿಥಿಂಗ್ ಇಸ್ ಫೈನ್
Can you hear me now, doctor?
ಬಟ್ ವೆರಿ ಲೋ ವಾಯ್ಸ್
Join again. Okay. Yeah, that's because you received a call and you rejected, doctor. Okay, let me take doctor again online. So this happens every time if you go live on Facebook, Instagram, or anyway. Whenever you go live, If you receive a call on your phone, the voice gets muted or the volume gets down immediately.
Right.
Okay.
I
Can you
received
hear me
a call.
now, doctor?
Yeah, everything is fine. So that is
Fantastic.
how now I'm just relaxing. My son is teaching after OPD. Only patients who become COVID negative, if any complicated surgeries, I am doing. That's all.
Okay. Great,
Otherwise,
doctor. Great
yeah.
to have such senior doctor, and you have a urologist family itself. Your son is also a urologist,
My
as
son
you
is
said,
also
and
urologist.
you're giving a great tribute or contribution in the field of urology for the nation. So, doctor, just to begin with the conversation that we are here for. So, I would like to introduce you again to all our viewers who are live now, since you got disconnected and connected back again. So we have Dr. Chandrashekar Ratkal from Bengaluru. He's a senior consultant urologist at Rescue Urology Hospital, Bengaluru. So it's glad to have you here, doctor. The conversation that we are going to have is something nobody wants to miss, because health is wealth, as we say, and any issues related to urology will lead to very serious issues that we've been hearing and we've been seeing in anybody's family. So I would like to ask my first question to you. We get to listen about something called prostate gland. So what is this prostate gland and where is it located in our body, doctor?
The prostate gland is a gland which is only specially present in males. It is not present in females, only in males. Okay, it's the important organ of the urinary system, genitourinary system.
Okay.
Okay, it is
Okay.
situated at the bladder neck. Bladder means where our urine gets collected. When we don't pass, then we pass. So it's a gate. At the gate of the bladder, it is present.
Okay.
The urethra, and where the urethra goes and joins the bladder, it is present in that at the bladder neck area. It is a walnut size structure.
Okay. Okay.
See,
Okay. Yes, doctor,
the
please.
whatever semen comes, no, 70-80% of the liquid is from the prostate.
Okay.
Okay.
Okay. So any issues that occurs in our body, the first question that comes to us is it because of the age issue? Is it an age matter?
Yeah.
Or do we get this issue because I'm so old, or 20s, 30s, 40s? So I would like to know that what is this BPH and what age group will be diagnosed with the BPH, doctor?
The expansion of BPH is benign prostatic hypertrophy.
Mm-hmm.
In contrast to, there is other condition called cancer of the prostate.
Okay.
This is
Okay.
benign. Benign means it is non-cancerous enlargement of the prostate. So it is not dangerous to the life. If it is properly diagnosed and treated, it is treatable and there is no problem at all.
Okay.
Age group means almost it starts at the age of 40 only, but incidence is very low, 8 to 10% only. After 50 up to 70, the incidence is almost around 50 to 60% of the people will have prostatic problem. After 60, 70, even it increases 70 to 80% or something. But only 70% of the patients only develop symptoms. Very common at the age. It's the aging process, one of the aging process.
Okay. Okay. What are the symptoms of BPH then, doctor?
Symptoms means there are mainly, it is grouped in two groups: obstructive symptoms and irritative symptoms. Obstructive because it compresses on the urinary passage at the opening of the bladder. So it will cause obstruction. To start with, it causes obstruction. Obstruction symptoms to start with hesitancy. What we call it, earliest symptom is hesitancy. That means any person who goes to the toilet, he can immediately start passing urine. But in hesitancy, he has to go, stand for some time, and he takes some time to initiate his micturition. As soon as he goes, he cannot pass. He has to wait. Then only it's that is called hesitancy. Then intermittency. Intermittency in the sense, while passing, it doesn't flow fluent flow. So he will have flow going, stopping, going, stopping. That is called intermittency. Then poor flow. The flow will be slowly going. He will take longer time. Okay, flow. Then after passing urine, some dribble, post-wide dribbling, what we call. Some urine will take us he cannot at one go he cannot pass urine. So there will be some dribbling. So and after that also he will never feel that he has completely passed urine. That incomplete sensation will be there, and sometimes they develop suprapubic pain, the pain in the lower part of the abdomen. These are all obstructive symptoms. There are symptoms which are called irritative. They are little late symptoms. As this the obstruction will be there, the bladder will try to compensate and manage somehow. So it will push against the and he will be able to pass. But in the process, while doing, you see, if any muscle you exercise, it becomes hypertrophied. So this muscle, this bladder is nothing but a muscle. It gets hypertrophied. And patient will start developing irritating symptoms. Irritating symptoms is urgency. See, wherever he may be, once he gets the sensation to pass urine, he cannot control long time. Sometimes even they leak. In late stages, they even leak under their clothes. That is irritative symptoms. Then because of that, they develop frequency. Instead of going 3 or 4 times a day, he may go 8 to 10 times a day. And what the worst thing is night time. Night time, instead of getting up 1, normal person may get up maximum 1. He may have to get up 2 times, 3 times, 4 times, 10 times. Sometimes it sleep get disturbed. These are all the early symptoms. Later on, after some time, he may develop passing blood in this hematuria, what we call it as, or urinary infection may come in, or he may completely goes into urinary retention. Even after delayed, then his kidneys may get affected. And it forms stones inside the bladder. So these are all the complaints: chronic retention, acute retention. So what happens? Urinary infection, passing blood in the urine, and developing urinary retention, acute or chronic, are affecting the kidney, are developing diverticulum stones. All these are complications of prostate obstruction. Till these comes, we call it non-complicated prostate. So that is again, when treatment part comes, I will tell you about it.
Okay, sure. So now, yes, doctor.
Okay.
Any routine test needs to be done for this, like diabetes, blood pressure?
First thing is good history we take. We sit with the patient, we talk to him. Usually elderly people, they love to talk, 60, 70, because they really like to see. I am also like that. So first we take proper history. We ask all the symptoms. If he has that, then the most important thing investigation we do is ultrasound of the abdomen and pelvic region. In ultrasound, what we see, prostatic size will come to know, and how much urine is remaining inside after passing, and also it is affecting whether it's kidneys, that also will come to know, or associated diverticulum, stone formation, all these things. That is one important test. After that, we'll ask him to do a urine flow test. That is called uroflowmetry. There will come to know his flow is slow. Sometimes they'll not be able to pass also, but slowly they'll pass. That uroflow also will tell us. After that, we'll get his urine examination routine, whether he has developed infection, and some blood investigations we do to know how his kidney status and other things. If he's a diabetic, we want to know the diabetes. But most important test in prostate concerned is what we call it PSA, prostate specific antigen, which will tell us whether prostate is cancerous or non-cancerous. Any patient, suppose we want to continue on medical, and this test is a must. Prostate specific antigen. These are the common tests we do. Nothing more complicated.
Okay. Cool, doctor. Then when it comes to dietary medications, modifications, do we have to modify our food style, lifestyle? What do you say, doctor?
Most important thing is water intake. Most of the elderly people, if you really check, they will not drink even half liter a day. At least they should maintain their hydration, because that too, especially when they develop these urinary symptoms, again they will reduce intake, because that is how they can compensate. So if they drink water, they have to go to bathroom. So they reduce. That's why hydrating themselves is very, very important. At least 1 liter, 1.5 liter water they have to consume. And especially as the evening comes, they should reduce their water intake. That is very important. So if they take evening more water, and if they drink coffee, tea in the evening or night, again they have to get up.
Intake needs to be reduced.
That will disturb their sleep. So that during the night, better let them be little dehydrated. But during the day, they have to hydrate very well. And having fresh vegetables, fruits, especially tomato. People usually blame tomato for stone formation. For prostate, tomato is very good. So these are the dietary advice. So other things, they should cut down their alcohol, or they should not take alcohol. Alcohol will aggravate their symptoms worst, and they go for urinary retention. So when they develop cough, cold, that time these medicines which they take for cold, cough, they should restrict. That will cause retention. They should take the proper advice of the doctor and take. Otherwise, there's no much. Main important thing, fresh vegetables, good amount of fruits they should take.
Water. Okay. Are there any specific treatment for BPH, doctor?
Yeah. Now the medicine is very much advanced. See, when I took up the medicine and when I was doing my surgery at the 1978 at Mysore Medical College, that time we were all just opening and removing the prostate, open surgery. Now it is quite advanced for prostate. Now, even that time we didn't have any medicines also. Now, lot of medicines have come. Our 70 to 80% of the patients, if they consult us well in time, we manage them with medicines only. Very good medicines are, but they will not cure, but they will not have any problem during their lifetime if they take medicines regularly. We have medicines to shrink the prostate. We have medicines to open the bladder neck properly and improve the flow. If they take regularly medicine, they can always manage. When they develop this irritative symptoms, we can control their irritative symptoms, also controlling urgency and other things. For that also, like that, we give either monotherapy or combination of drugs. Like that, we give. Medical treatment is very good today. Only thing, they should consult doctor as early as possible for their disease. So what they think, I am early, this is what is there 10 times, even if you go to, I'll be home only. So because they'll be at home now, even if there's little sensation, they'll go bathroom. See, that's why sometimes we have to teach them bladder behavior therapy also, how to control, how to pass urine. That also very good medical treatment is there. So apart from that, so many times the symptoms are not worse, we tell them behavioral therapy. That is just with managing the water intake and how to pass urine, timing, waiting time, all this they have to modify. Those things also we teach. Suppose if they are not responding to medical treatment, we have surgical treatments. With laser we do, with bipolar we do. We cut that prostate through the urethra. Nowadays we don't, but when I started my career, we used to open the abdomen and remove the prostate. No, not necessary. We go through the natural with laser or with some energy. We use electrical current or that is bipolar or laser. With that, we can cut the prostate and make the passage wide, and they will start passing. So now new things are coming up in the prostatic surgical treatment, where hydrotherapy is coming, and prostate lip, just we tie the prostatic lobes. Like that, so many things are coming up now.
Okay. Great, doctor. Great to know that. So I have just 2-3 more questions left. Before asking that, there is a comment from Sandhya on our live video. So she's asking a question. I would like to just reiterate that question to you. How long does it take for medicines like Silodal to take the effect in BPH? This is what she's asking. Would you like to answer to her question, doctor?
Effect will start within 24 hours only after taking that medicine. Within a week, they will have full effect. Medicine should be taken lifelong. If they want to avoid surgery, these medicines should be taken after a long time. As on today, we have got about 10 years study or something like that. At least I myself even I gave treatment to Mr. Nizlingappa. He was after 10 years, these medicines, and he never required surgery. Like that. Understand? Medicine should be taken as my knowledge goes.
Of Karnataka.
Yeah. 4 times CM. He was my patient.
He's from my hometown, Chitradurga.
Chitradurga. You are from Chitradurga. So nice.
Yes.
See, he's my one of the very proud patient. He's one of the best person I have seen in my life. Nowadays, that's why I don't like to see any politicians.
Okay, so just to continue with the same topic, you said if you're taking the medicine that is called Silodal or Silodal, you have to take it the lifelong, you said, or you have to go through the surgery. So
Pardon?
Are there any side effects of these medicines, doctor? Because you have to take lifetime.
See, the Silodacin is the most safest drug, but only thing, what we call it as usually after when they have intercourse, ejaculation will not occur when they take cetirizine. That's the only side. That's why we never give it to youngsters who are sexually active. We give it only very elderly persons who can be managed. They will not have botheration of the ejaculation. That's the only worst side effects. Otherwise, little postural hypertension is there. Postural hypertension means night time when they get up to pass urine, the BP will fall down. So they may suddenly go and fall in the toilet. That's why they should carefully get up, sit for some time, stand for some time, then slowly go to the bathroom and pass it. That care there. But with silodacin, postural hypertension is not a big issue. These are only two. Sir.
Okay. Great, thank you. I hope Sandhya got her answer. So now, doctor, just before winding up, since having a senior urologist like you on our Instagram live, I would also like to ask few tips for the women as well, because we spoke everything about BPH and prostate gland that is related to men's life, men's body. So any basic tips that you would like to give it to all the age group of ladies to maintain a good body, and we should never go and visit a urologist for our issues, doctor.
They can't escape from urologist. Whatever symptoms there. See, if you take a 65 or 70-year women and 70-year man, their urinary symptoms are same, but causes are different. Okay. There is that. So whatever they develop urinary symptoms, no, they are also age related. Women, they have to do at any age the best. I feel yoga. Yeah. Yoga. Dieting, yoga, and about the diet they have to be very, very careful. Take more of fresh vegetables and fruits. That is very good. Daily they should at least go for walk. But even better than walk is, I feel yoga is best for any age. Yoga. Any lady should start, even at 70, she can start her yoga.
Doctor. Yoga is
best.
Yeah, great.
Also do
yoga
it regularly.
Is all-time medicine and kind of.
I'm telling so for urinary control also yoga is best. There are some pranayams, with that they can have excellent urinary control, because most of the elderly ladies, they will not have urinary control. That will happen better.
True. Yes. That's wonderful, doctor. Yoga is an answer to any kind of health issues.
Many things. Yeah. That's why our Prime Minister is there, no? See,
great. Yes.
At the age of 69, also active. Wonderful. We have to learn from him.
Yes, doctor. True, very true. One of the most inspirational person of India. So, doctor, in this situation, as part of Prostate Health Month, are there any specific suggestion to the audience or the viewers under COVID situation by you?
Yeah. See, unless it is emergency, please avoid going to hospital. Elderly people need to stay at home. Better to avoid going out, and especially to hospital. That is where they contact corona. That is the main advice for me. Unless emergency, if they develop retention, see, now I hardly see any retention patients. Very less, because they are at home, very comfortable. I think their food, everything is going on very well regularly. That is the one thing I tell. Unless emergency, do not get any surgery done. We have discussed in the Urological Society of India, only emergencies to be operated, no elective surgeries. This is pandemic. That's all. That is the idea. COVID time.
So to
safest thing, be at home, enjoy at home.
Yeah. I was about to say that. To avoid going to the hospital, we have to be stay at home.
Yes,
stay safe, and have good food.
Online. Online, they can talk to the doctor. And he can give. If he is an old patient, most of my old patients, they will call me. I will tell them, follow this. They will be all right.
Great, doctor. It was great talking to you. In this tough situation, everybody is going through a lot of issues. As you said, we already know that if there is any issue related to our body, everybody is little apprehensive to go and visit any doctor, because
apprehension should go.
Yeah. No, it is there already in our mind, because in the time of COVID, do we really have to go and visit any hospital?
We have to keep ourselves fit. Most important thing is we have to keep ourselves fit. Anything, if you keep your lung strong, COVID will not come at all. Lung should be strong.
Okay. Yeah. So
Because I
yoga
do
and yoga
last
and
week only.
basic.
Yeah, last week I had to catheterize a lady who had come with a retention because I knew very well, but I had gone with all PPE kit. She's also fine. I started on treatment. Nothing has happened to me. I am fine. she was,
You are
she
always,
was
sir. You're
next,
always
next day
glad.
we came to know COVID positive. See, as long as you are fit, I tell her, yoga is helping me a lot. I also started
Yes.
very late. Just 6 months back I started. January I started my yoga, but still,
Uh-huh.
all these years I don't know why I missed my yoga.
Wow, wow. Then we have to get inspired by
Really,
you, doctor. At this age, also, you have started doing yoga.
2 hours I
Though
do in
it's
the morning.
something, yeah, yeah. There is a saying in Hindi also, "Jab jago tabhi savera," they say. So there is no
Jarur, jarur.
delay, there's no late for
No,
anything to start new
no,
in
no.
our life.
We can do 2 hours, 20 Surya Namaskar and all other asanas. I feel very, very happy and healthy.
Wonderful, doctor. Wonderful. Great talking to you. And would you like to share your email ID or contact number to the to
Yeah,
anybody who would
definitely.
like to?
Certainly. 98452 55378. All my
Please.
patients have my mobile number. All my patients. Anytime, even midnight they call, immediately I answer them.
That's wonderful, doctor. It's very rare to see
98452.
such
Yeah,
doctors
because
nowadays.
I have worked in government hospital. 36 years I have done government service for the poor patients. So I have that. And even though I have established a very
Kindness
good
towards patient. Yeah.
Bangalore, Kengeri Satellite is my hospital. I have especially only urology hospital, 50 bedded. Even then, see, I am doing very well. I am very happy because whatever
Wonderful.
poor patients are in the government service, they come to me, they bring me patients, and their good wish helping me a lot. Okay, so that
True,
is how
true,
I
doctor.
tell.
True. Wonderful, doctor. So, can you just repeat your number once again? Somebody is asking. Just once.
98452 98452 55378. Anybody can call me anytime, no problem.
Nine eight
Okay.
four five two double. Yes, doctor.
98452 55378. If you want my
Double five
hospital
six.
number also, you can take. My hospital number also they can take. 080 2848 3939.
Okay. Great, doctor.
Hospital number
Wonderful.
3938. One
If
more is 3938. Okay.
okay. So anybody
And
who can go on Google.
email, doc, email means dr.csrattkal at gmail.com. dr.csrattkal at gmail.com. Anybody can put anything. And same number is WhatsApp number. They can send their material on WhatsApp. I'll just go through and whatever best advice I can
Wonderful,
give.
doctor.
Sure.
Very nice, doctor. We got to know that you're so approachable. Also, it is not that easy to see such
You should
doctors,
know.
especially
If
in
you are not
cities like Bangalore nowadays, because it is very difficult to track a doctor itself. If there is any emergency, it is very
I know.
risky. That is one of the reasons patients gets little scary and apprehensive. Okay, doctor is not available. Is he going to treat us well? Is he kind to us? But with your words, it is very clear that you're approachable and you're very kind also. And it is my
Okay.
pleasure talking to you, and I'm very sure all the viewers will be happy to get in touch with you if there is any issue regarding to
Yeah.
urology. And for everybody whoever is in Bangalore, whoever comes down to Bangalore, can visit Rescue Urology Hospital, Bangalore. You can just Google it; you'll get the address also.
But
Thank you,
your
doctor. Any
Suprabhat,
last message
your
you would like to give?
no, your Suprabhata is excellent. I hear it.
Thank you,
I love
doctor.
it. It's so
Thank you.
nice, very melodious, and your voice will be so good on Suprabhata. I really like that program. Most
Thank
of
you.
the times
Thank
I
you.
hear it. Welcome,
Thank you so
welcome.
much,
There is
doctor. It's my
compliment to you.
pleasure.
I was very
Thank you so
happy when
much.
they told Divyashree. No, no, I know Divyashree very well because probably you don't know me.
Wonderful. I
Yeah.
definitely know you, doctor. Everybody knows you now. Thank you
Well,
so
your
much.
Suprabhata is
I
one of
wish.
the best Suprabhata. I don't want to any other channel. I only listen to you afterwards. Or madam, I am not getting her name. Who is you? After
Shruti.
that, you are Shruti. Shruti. I know her very well, but name I have said it.
Yeah,
Okay,
yeah.
very
Thank you,
nice
doctor.
meeting you.
Pleasure, pleasure.
Okay,
I'm blessed that you are my listener, and pleasure talking to you.
I
I
am.
can get in touch with you. I've taken your contact number as well.
Yeah, sure, sure. You are welcome
Okay.
anytime. Okay, any
Thank
patient,
you, doctor.
poor
To everyone
patients,
who is
can
watching
get.
this.
Yeah, yeah. Okay, fine. Thank you.
Yes.
Bye.
Yeah. To everyone who is watching us live, you can follow Dr. Chandrashekar on his Instagram account, and me at RJ Divyashree. You can type in as RJ space DIVYASHREE, RJ Divyashree. You will find me there. Thank you so much once again for everybody who has joined.
Namaste, namaste, namaste. Nice meeting you. Okay, bye. I never thought I will be seeing you live. Live. Okay, bye.
Thank you, Doctor. Pleasure, Doctor. Pleasure.
Pleasure, very pleasure. So nicely interview. You have conducted interview excellent.
Thank you.
Okay. Bye.
Thank you, Doctor. Thank you, Doctor. I'm just ending the video. Yes, Doctor.
Bye.